The large intestine meridian of Han Yang Ming starts from the radial corner of the index finger. To find large intestine 1, Shang Yang, we draw a line here and another line here, and the point is located where the two lines meet, 0.1 tun away from the corner of the nail bed of the index finger. Large intestine 2, 二间, is located distal to the second metacarpophalangeal joint, in between the red and white skin on the radial side, right here. This point can be located with the patient's fingers slightly flexed or with the patient making a loose fist. Large intestine 3, 三间, is located proximal to the head of the second metacarpophalangeal joint on the radial side. Large intestine 4, 合谷, is located halfway of the second metacarpal bone, in between the first and second metacarpals, right here. Large intestine 5, 阳溪, is located in the anatomical snuff box. We can locate this point by asking our patient to extend and tense the thumb, and the snuff box will become prominent, and the point is here, in line with the wrist crease. Large intestine 6, 偏里, is located 3 tun above large intestine 5. So before we find this point, we should locate large intestine 11. We locate large intestine 11 at the midpoint between the lateral border of the tendon of biceps brachii and the lateral epicondyle. This is usually the same point as the lateral end of the cubital crease when the arm is flexed, right here. We then visualize a line connecting large intestine 5 and 11, which measures 12 tun, and we halve that to get 6 tun, and halve it again to get 3 tun, and large intestine 6 is here. Large intestine 7, 温溜, is located 5 tun above the wrist crease or 7 tun below large intestine 11. To find it, we measure the 12 tun between large intestine 5 and 11, halve it to get 6 tun, halve it again to get 3 tun, then divide this into thirds, and we have 5 tun above the wrist crease here. Large intestine 8, 下连, is located 4 tun below large intestine 11, or 8 tun above the wrist crease. So we measure the 12 tun between large intestine 11 and 5, and divide that into thirds, and the proximal third is 4 tun from large intestine 11, right here. Large intestine 9, 上连, is located 3 tun below large intestine 11. So using the 12 tun between large intestine 11 and 5, we divide that into half to get 6 tun, and halve again to get 3 tun, and large intestine 9 is here. Large intestine 10, 手三里, is located 2 tun distal from large intestine 11. So we have 12 tun between large intestine 11 and large intestine 5. To locate large intestine 10, we divide that into half and half to get 3 tun, and divide this into thirds, and 2/3 away from large intestine 11 is large intestine 10. The point is here, radial to the radial bone when the arm is in this position. Large intestine 11, 曲尺, is located at the midpoint between the lateral border of the tendon of biceps brachii and the lateral epicondyle. This is usually the same point as the lateral end of the cubital crease when the arm is flexed right here. Large intestine 12, 肘髎, is located 1 twin superolateral to large intestine 11 when the elbow is flexed. We know that the measurement between large intestine 11 to the anterior axillary fold is 9 twin. So we divide the 9 twin into 3 sections to get 3 twin, and divide that again into 3 sections to find 1 twin, and the point is here. Large intestine 13, 手无里, is located 3 twin above large intestine 11, meaning that it is 1/3 the distance between large intestine 11 and the anterior axillary fold. So we divide this 9 twin into 3 parts, and the distal 1/3 is large intestine 13, right here. To locate large intestine 15, 肩盂, we ask our patient to abduct their arm, and that would reveal 2 dimples on the top of their shoulder. And the posterior dimple is 三焦 14. The dimple on the anterior side is large intestine 15, so large intestine 15 is here. Large intestine 16, 距骨, is located in the depression between the spine of the scapula and the acromial end of the clavicle, right here. To locate large intestine 17, 天顶, we ask our patient to turn their head slightly to the side to reveal the sternocleidomastoid muscle. In this position, we can see the sternal head and the clavicle head of the SCM muscle. Before we can locate large intestine 17, we need to first locate large intestine 18, 浮突, which is in between the 2 heads of the SCM muscle, level with the Adam's apple, or the superior border of the thyroid cartilage. Once we have found that, we can find large intestine 17, which is located 1 twin below large intestine 18, level with the cricoid cartilage, and posterior to the border of the SCM muscle. Large intestine 19, 口合髎, is located in line with the lateral margin of the nostril and at the level of the midpoint of the philtrum. Large intestine 19, 口合髎, is located at the level of Du 26, which is the midpoint of the philtrum here, and in line with the lateral margin of the nostril. So the point is here. The last point of the large intestine meridian is large intestine 20, 迎香. It is located in the midpoint of the lateral border of the ala nazi in the nasolabial groove, right here. To needle large intestine 20, first we swab the area. The point is located at the midpoint of the ala nazi in the nasolabial groove. So we place the guide tube on the point and angle it along the bridge of the nose. Then we tap in. Using these 2 fingers, we hold the needle this way and insert the needle as transversely as possible, pointing towards bladder 1. To withdraw the needle, we place the cotton on the point and slowly withdraw the needle. Points on the face tend to bleed or bruise easily, so we need to keep the cotton on the point for a couple of minutes, or we can ask our patient to hold the cotton ball in place for a while.